every jab is providing protection against COVID-19. Officials in England shared data from 2 studies showing reduced disease with a single shot and a 75% drop in hospitalization and death in elderly people.
Overall, we're seeing a really strong effect to reducing any infection, asymptomatic and symptomatic. This is the first time that this has been done in a systematic way for the Pfizer-BioNTech vaccine.
With more being learned about the vaccines, France is looking to try something new. The country's health minister is expected to decide soon if people who have had the virus will get just 1 shot.
Everything we're doing in terms of vaccine doses is safe in terms of people taking it. The risks are largely in the other direction. Is this going to be sufficient to protect the person who gets vaccinated in the long term?
2 small studies from the U.S. out of Mount Sinai Medical School and the University of Maryland showed a single dose in people who have already contracted COVID-19 provided at least the same amount of protection as 2 shots in people who haven't been infected. The data has not been peer-reviewed. If France makes the switch to a single dose, it could maximize vaccine supply.
The reality is, and we've seen in Canada, we are at the level of resource scarcity when supply chains dry up and that type of thing. So, there is something to be said about doing this.
Citing evolving knowledge, the health authority in France updated its opinion, saying those who have been infected should wait a minimum of 3 months before getting a single shot.
Collecting this data now in real time is going to be super important for the rest of the world to get the most optimal vaccine strategy.
It doesn't appear any other country is considering this strategy for people who have had the virus. Crystal Goomansingh, Global News, London.